Having worked in the institutional structure for so long in my work life, I just knew I wanted to be closer in on the neighborhood and what's happening in the neighborhood and how are neighbors helping neighbors be. I realized this is the future of healthcare. It's going to be in the neighborhood. No matter how we lean into the large healthcare institution as being the healer, I think that in fact a lot of the healing is happening right on our streets. Somebody being present on the block in your neighborhood who has some know-how is just a huge resource for the community. So I fell into this role right on my block, and that's really where the center was born. It was at the intersection of Cherry and Providence Avenue in Winnetka.
Hi, my name is Jason Altilio, and I am a PhD student in philosophy at the City University of New York. Basically, I've already sort of taught future physicians bioethics, and I've worked with the NIH in creating policy governing research. So I've had a lot of experience applying principled ethics to very abstract ideas and teaching it from a physician's perspective. So I came to the Center for Ethics and Advocacy because I wanted a more down-to-earth approach, one that really focused on the patient, and I also wanted a more direct, active role in helping patients deal with basically unethical behavior in the system around them.
I'm Katie Duncan, and I'll be a senior at Taylor University this coming fall, and I'm double majoring in philosophy and biblical literature. I applied for the internship at the center because I was mostly interested in the ethics aspect of it and how people make their decisions and what they incorporate in them, especially if they incorporate religion. I was really interested in how that affects their decisions. I had taken 2 theory classes in ethics in college, and I was just looking for a more applicable way of how people make decisions. And I was also interested in the ministry aspect of it and just helping people make decisions and make educated, informed decisions on their health care and just helping people when they need help.
Hi, my name is Anam Aslam. I'm going to be a senior at New Trier Township High School this fall, and I joined this internship at the center because I want to go into pre-med and I want to be a physician, and it's always bothered me that sometimes physicians aren't doing the ethical thing and the thing that's morally right, and so I joined the center to gain perspective into the field and to learn how that can be changed.
Hi, I'm Lanny Leon, and I'm going to be a senior at New Trier High School this fall. And I've been hearing a lot of reports lately about how our healthcare system is in need of a lot of reform. And I just thought that by interning this summer at the center that I could make a difference and impact our system in a positive way, and also get the ethics education that I need to help me pursue a career in healthcare.
I had no idea this summer would go the way it went. This time I had a feeling religion and philosophy were going to be in this, and where do ethics and religion and philosophy and end-of-life decisions all come together, separate, and how do you really see it? What do you see and how do you interpret it? So we're getting the lived experience in the midst of the questions and queries about religious traditions, and how do you separate it all and how do you make sense of it all?
During this internship, interreligious dialogue and spirituality have come about in our discussions, and to take that to a next level, we visited a local barber in Winnetka named Larry. Larry was recently diagnosed with cancer, but he's been willing to talk about his experience with members of the community, and his sharing his story has helped bring the community closer, as well as helped him deal with the chemo. Later that day, we talked to Dr. Magrisso, who had a near-death experience and who also shared his experience in an article he wrote. This article urged physicians to take notice of the spiritual side of patients and see the patient as a whole.
At guardianship court, we saw a case in which a grandma was the guardian of her grandson, and they needed permission to go out of the country, and it was shocking to me because I had no idea that so much information and time and effort and involvement of the judges is put in to one kid's case, and it was really nice to see everyone's involvement and care for him.
One of our speakers, Lourdes, came in, spoke to us about the insurance industry, and I really appreciated her general overview and teaching of what the insurance industry does and what is working and what is going wrong with it. And she explained it very well, and I think it was very good for us to hear exactly how that works and why it works. The last week of the internship, we visited Jay Lukowitz, the executive director at Oakton Pavilion, which is a nursing home in the area. There, Jay told us of the improvements being made among nursing homes, and he took us on a tour of current improvements that are happening at Oakton, which include renovations of special rooms for music, art, private dining, and a playroom for grandchildren. It was refreshing to see that even though Oakton is a for-profit nursing home, Jay cared deeply about the quality of care he provides for the elderly.
We had an interesting speaker named Judy Hassis, who works at the Community Health Center. It's a free clinic in downtown Chicago, and what I found the most interesting thing that she said was that in this economy, people are willing to provide free services. Physicians are coming out and giving their time and knowledge to patients.
People get down and discouraged, and for them to come back, they have to have somebody else who believes that with them. And somebody who doesn't believe that power, good looks, money, all of that is the best. What's the best is that we are willing to be transformed by some of the tough things that hit us during life. One of the favorite images that I carry with me from nursing school is caring for a man who's, maybe I haven't told you all this story, he had a huge abdominal wound. He had had surgery, and the wound dehisced. It opened out. The stitches broke. So we had to bring him back to the operating room, and he was, instead of stitching it, they packed it. And every day, 4 times a day, we all took turns repacking the open wound. And it finally closed in. He had this huge scar, a deep wound, but a huge scar. And I've thought to myself so frequently in the years since that wounds have to heal from the inside out. And I really believe in that's a psychological, spiritual reality as well as a physical reality.
I'll just tell you a little bit about the Center for Faith and Community Health Transformation. Taking this idea that community is at the heart of health and healing. That if we're going to really transform the health of our communities, we have to be first concerned about the kind of relationships that we have with each other. Faith communities have unique things to offer in addressing the social issues that impact health. So poverty, racism, employment, housing, all those kinds of things that have a profound impact on the health status of people in the community. Those are things that faith communities are concerned about and are interested in. And so part of what we're trying to do at the center is figure out how to mobilize the unique things that faith communities do to impact these social issues and to help create these loving communities that we're talking about.